Before you keep scrolling, I need you to hear this, because it could change how you deal with your back pain for the rest of your life. If you've been diagnosed with lumbar spinal stenosis, chances are a doctor sat across from you and said the same 3 things everyone hears: take pain medication, get an injection, or consider surgery. As if those are the only doors available to you. But what if I told you there's a door nobody showed you? A handful of specific movements, nothing fancy, nothing that requires a single piece of equipment, that can start relieving pressure on your spine in a matter of minutes, right in your own living room. I'm not talking about vague, just stay active advice. I'm talking about 5 precise, carefully chosen exercises that target exactly what's happening inside a stenotic spine. I've used these with patients who came in barely able to walk to the mailbox and watched them regain real, lasting relief, without a prescription pad in sight. In this video, I'm going to walk you through each one, step by step. I'll explain exactly why each movement works specifically for stenosis, not just generic back pain. And by the end, I'm going to reveal the everyday movements that are quietly making your stenosis worse, movements you're probably doing right now without realizing it. Stay to the end, because that last part alone could save you months of setbacks. Before we jump into the exercises, I want to take a moment to explain what lumbar spinal stenosis actually is, because this understanding is exactly why these 5 exercises were chosen so deliberately, rather than just picked at random off a generic back exercise. Lumbar spinal stenosis refers to a narrowing of the spaces within your lower spine. That narrowing can place pressure directly on nearby nerves, which is why so many people experience back pain, leg pain, heaviness, tingling, or weakness, especially after standing or walking for extended periods. Here's the critical piece of information most people are never told. Certain body positions increase that pressure, while other positions relieve it. And understanding that difference changes everything about how you manage this condition day to day. This is why flexion-based movement, meaning gentle forward bending or rounding of the spine, tends to help so many people with lumbar stenosis. That position actually opens up additional space within the spinal canal, taking pressure off irritated nerves. It's the reason symptoms often worsen when standing tall or arching backward, yet improve when leaning forward, sitting, or resting against a support surface. Every exercise in this routine is built around that exact principle. Now, everybody responds a little differently. Some people find the most relief doing these movements seated. Others prefer standing. Some do best lying down. That's completely normal, and there's no wrong answer here. I'll give you options throughout, so you can settle on whichever version your own body responds to best. You don't need to force every variation, and you never need to push through pain. You simply need to find what works for you. Exercise 1. Seated forward flexion. Let's begin with exercise number 1, seated forward flexion. This is one of the simplest, most accessible ways to relieve pressure in your lower spine, and for many people, it delivers noticeable relief almost immediately. We're starting here because it's gentle and low risk. Leaning forward while seated increases space inside the spinal canal, which can take pressure off irritated nerves and calm discomfort in the back, hips, and legs. What you may notice: less stiffness, a lighter feeling in your legs, or a subtle sense of relief spreading through your lower back. Some people feel this shift right away. Others notice it gradually, after several repetitions. What it should feel like: a comfortable stretch, a gentle sense of unloading in your lower back. What it should never feel like: sharp pain, worsening symptoms, or strain. If that happens, ease back and shrink your range of motion. How to do it: sit on a sturdy chair, feet flat on the floor, hands resting on your thighs. Slowly lean forward, letting your spine round naturally as your hands slide down toward your knees or shins. There's no need to force it or reach the floor. Let gravity guide the movement. Pause briefly once you reach a comfortable point, then slowly return upright. That's 1 repetition. Perform 10 reps, moving slowly and deliberately, for 2 to 3 sets. This can be done once or twice daily. It's especially useful when symptoms flare after standing or walking. Keep your breathing relaxed throughout. This exercise is about creating space, not testing your limits. Exercise 2. Seated pelvic tilts. Next, seated pelvic tilts, a movement that improves spinal mobility while reinforcing that same relieving, flexion-friendly position. We're placing this right after forward flexion because it keeps you in a safe, supported seated position while encouraging your spine to move smoothly, rather than staying locked and guarded. What you may notice over time: less tightness in your lower back, better control of your spinal movement, and an easing of that locked-up feeling, which can make transitions like standing up or sitting down feel noticeably easier. What it should feel like: a mild rocking sensation through your pelvis, a gentle flattening and unflattening of your lower back against the chair. It should feel smooth and controlled, never forced. How to do it? Sit with your feet flat on the floor, hands resting on your thighs, starting in a neutral position. Slowly tilt your pelvis backward, gently rounding your lower spine as though tucking your tailbone underneath you. Hold briefly, then tilt forward, but stop at neutral rather than moving into a full arch, since we want to avoid extension with stenosis. Move smoothly back and forth between these positions. One full cycle counts as a rep. Perform 10 reps for 2 to 3 sets, once or twice daily, particularly helpful if your back feels stiff after long periods of sitting. Focus on control rather than range. Small, precise movements are often more effective here than large ones. Exercise 3. Sit to stands. Exercise number 3 is the sit to stand, a movement essential for daily function and confidence. For people with stenosis, the simple act of standing up can sometimes trigger pain or leg symptoms, especially when done quickly or with poor mechanics. This exercise retrains your body to transition from sitting to standing in a way that reduces spinal stress instead of amplifying it. What you may notice: better control as you rise, less initial stiffness, and improved leg strength, without aggravating your back. What it should feel like: your legs doing the majority of the work, with your back staying comfortable and supported throughout. It should never produce a sharp spike in back or leg pain. If it does, slow the movement down or reduce how tall you stand at the top. How to do it? Sit near the front edge of a chair, feet shoulder-width apart and flat on the floor. Lean your upper body slightly forward while keeping your back comfortable, then push through your heels to stand. Pause briefly at the top, then lower yourself back down with control. Avoid arching your lower back once upright. Stay tall, but relax. One full sit and stand cycle counts as a rep. Perform 10 reps for 2 to 3 sets, once or twice daily, especially if you notice stiffness after sitting for a while. Focus on smooth control rather than speed. Exercise 4. Standing forward bends. Exercise 4 moves us to standing forward bends, because daily life inevitably requires time on your feet, and this movement teaches your spine how to unload and reset while upright. What you may notice: reduced stiffness in your lower back, less leg discomfort after standing, and quicker relief when symptoms start building during the day. What it should feel like: a gentle stretch or sense of decompression through your lower back and hips. It should never involve sharp pain, dizziness, or worsening leg symptoms. If it does, reduce how far you bend, or return to a seated position instead. How to do it? Stand with feet hip-width apart, knees slightly bent. Slowly hinge forward, letting your upper body relax and your spine round comfortably as your hands slide down your thighs toward your knees or shins. You don't need to touch the floor. Pause briefly in the bent position, then slowly return upright, stopping at neutral rather than arching backward. That's 1 rep. Perform 10 reps for 2 to 3 sets, once or twice daily, especially after standing or walking for extended periods. Move slowly, and keep breathing steady throughout. Exercise 5. Knee to chest. We'll finish with exercise 5, single or double knee to chest, often the most comfortable movement in this entire routine, and a wonderful way to close things out or unwind before bed. What you may notice: a sense of relaxation across your lower back, reduced tightness, and calmer leg symptoms. What it should feel like: a gentle stretch through the lower back and hips, along with a feeling of unloading or decompression. It should never involve sharp pain or increased nerve symptoms. If pulling both knees in feels too intense, simply stick with one leg at a time. How to do it? Lie on your back, knees bent, feet flat on the floor. Bring one knee toward your chest, using your hands behind the thigh or shin to gently assist. Hold briefly, then lower your foot back down. For the double leg version, bring both knees toward your chest simultaneously, keeping your shoulders relaxed and your breathing steady. Never force your knees in. Let the stretch stay within a comfortable range. Each pull counts as a rep. Perform 10 reps for 2 to 3 sets, once or twice daily, particularly helpful before bed, or whenever your back feels tight and irritated by day's end. Once you finish, take a quiet moment to notice how your back feels compared to when you started. Together, these 5 movements work as a system, reducing pressure, improving mobility, and giving you flexibility to choose whichever variations suit your body best on any given day. The movements that make it worse. Now let's talk about something just as important as the exercises themselves, because doing the right movements only tells half the story. Doing the wrong ones, even by accident, can quietly erase your progress. This is where so many well-meaning, motivated people get stuck. They're consistent. They're doing everything they think is right. And yet they're unknowingly reintroducing the exact pressure they're trying to relieve through everyday activities and exercises that work against them. The single biggest culprit is repeated or prolonged back extension, arching your lower back. Movements like back bends, prone push-ups, or anything that pushes your spine into an exaggerated upright or arched position can actually increase narrowing in the spinal canal and trigger a flare-up in your back or legs. What makes this especially deceptive is that these movements often feel completely fine in the moment. The pain shows up later, after the damage is already done, which makes the connection easy to miss. The second issue is excessive twisting or rotation, particularly when it's combined with bending or lifting. Rotational movement can irritate sensitive joints and nerves within an already narrowed spine, even when performed slowly or with minimal resistance. This doesn't mean rotation is forbidden entirely, but aggressive or repetitive twisting is something a stenotic spine typically tolerates poorly. Finally, be cautious with long, uninterrupted walks or extended standing. Walking is frequently recommended for general health, and for good reason, but many people with stenosis notice their symptoms build the longer they stay upright without a break. Rather than pushing through discomfort, try breaking your walks into shorter intervals, and lean gently forward on a counter, cart, or walker periodically to give your spine brief moments of relief. Here's the core takeaway. Real relief from lumbar spinal stenosis isn't only about adding the right exercises to your day. It's equally about removing the specific movements that increase pressure and irritate your spine. When you combine both, the right additions and the right subtraction, symptoms become far more manageable, and everyday activities start to feel genuinely doable again. You now have a complete, stenosis-specific routine you can safely practice at home. Nothing aggressive, nothing complicated, just simple, targeted movements designed to reduce pressure, calm symptoms, and help you move through your day with far more confidence. And above all, remember this, even small, consistent movements, done correctly, can create real and lasting change over time. There is always something within your control that can help you feel better. If this video helped you, please consider liking and sharing it. It helps other people dealing with spinal stenosis find real, practical help instead of feeling stuck between painkillers and surgery. I genuinely love to hear from you. Which exercise gave you the most relief? Was it the pelvic tilt or the knee to chest stretch? Drop a comment and let me know. I read every one, and your experience helps guide others watching this video too. And if you'd like more simple, proven strategies for feeling better and moving better, go ahead and subscribe to the channel. If you're wondering why your leg pain seems to get worse specifically with walking and standing, that's exactly what we're covering in